Today, we're diving deep into a global health crisis that, for the most part, unfolds in complete silence: hepatitis C. It's one of the world's most widespread infectious diseases, but it's still so deeply misunderstood. So in this explainer, we're going to break down the science of the virus, the quiet devastation it can cause, and the incredible medical revolution that offers real hope for getting rid of it for good. So first things first, let's just try to get a handle on the scale of this threat, because hepatitis C really does operate in the shadows. Its true impact is often way underestimated. But believe me, the numbers, they paint a pretty stark picture.
Okay, get this. As of 2019, an estimated 58 million people around the world are living with a chronic hepatitis C infection. To put that into perspective, that is more than the entire population of Spain. And here's the kicker: the vast majority of them don't even know they have it.
And the consequences are absolutely lethal. In that same year, 2019, the virus led to roughly 290,000 deaths. That's a number that's right up there with tuberculosis, and it's actually higher than the number of deaths caused by AIDS that year. It really is a massive health crisis that's just hiding in plain sight.
So what exactly is this thing? Well, hepatitis C is an infection caused by the hepatitis C virus, or HCV for short, and its primary target is the liver. The virus's most dangerous trait is how it works, silently, often for decades, without the infected person ever knowing they're under attack. All right, so let's get into the science of this invisible attack. We're going to look at how the virus spreads and how it wages this secret, decades-long war inside the body. HCV is a blood-borne virus. Now, this is the crucial point to understand. It means the virus is transmitted only through blood-to-blood contact. You can't get it from hugging someone or sharing food or any other kind of casual contact. The enemy is in the blood. So, this means the main ways it gets around are all related to blood exposure. Globally, the most common way is through sharing needles for injection drug use. Other risks include things like poorly sterilized medical equipment and, way back when, blood transfusions. The good news is rigorous screening started around 1991, so today the blood supply is incredibly safe.
Okay, so after someone is first exposed, one of two things happens. This initial phase, it's called the acute phase, is often so mild that people don't even notice it. Now, a lucky few, about 20 to 25%, have an immune system that just clears the virus all on its own. But for the vast majority, the virus sets up camp for the long haul and the infection becomes chronic.
This timeline really shows you the sinister way this disease progresses. It starts with that unnoticed acute infection, which just quietly shifts into a chronic state. And for years, even decades, the virus just hangs around, causing this slow, steady damage to the liver, until one day, that damage becomes too severe to ignore.
The damage all begins with persistent inflammation. You can kind of imagine the liver in this constant state of high alert, fighting an intruder that it can never actually beat. This chronic battle causes irritation and swelling in the liver tissue, day after day, year after year.
And over time, that constant fight really takes its toll. The liver tries to heal itself by producing scar tissue, and that process is called fibrosis. The problem is, unlike healthy liver tissue, this scar tissue doesn't really do anything. It's kind of like patching a flexible, soft fabric with a piece of stiff leather. The organ just gets harder and less effective.
Now, if this goes on unchecked, the scarring can become really severe. In about 5 to 10% of patients, after about 20 years, so much scar tissue has built up that the liver's basic structure starts to break down. This is a condition called cirrhosis, and it's a state of severe dysfunction that can lead to total liver failure.
And this is the endgame for far too many people. A liver with cirrhosis is basically fertile ground for cancer. Cirrhosis dramatically increases the risk of developing a deadly form of liver cancer. This slow, silent progression from a simple infection all the way to cancer is what makes hepatitis C a true silent killer.
But, and this is a huge but, the story does not end there. Just when this crisis seemed completely insurmountable, science delivered a breakthrough so profound it changed absolutely everything. This is the story of the cure.
I mean, when you look at how the treatment has evolved, it's just night and day. The old way, with something called interferon, was just grueling. We're talking up to a year of injections with awful flu-like side effects, all for less than a 50-50 chance of it even working. The new treatments, called direct-acting antivirals, or DAAs, they're just simple pills. You take them for 8 to 12 weeks with almost no side effects.
And the result of these new treatments? A cure rate of over 95%. Let that just sink in for a second. This is honestly one of the greatest medical achievements of our time.
In just a decade, science took a chronic, often fatal disease and turned it into something that's almost universally curable.
So what do we actually mean when we say cure? Well, medically, it's called a sustained virological response, or SVR, and it's pretty simple. It means that 12 weeks after a patient finishes their treatment, there is no detectable hepatitis C virus left in their blood. The virus is gone, for good.
So, if a cure exists, you'd think the war would be over, right? Well, it's not. The biggest challenge in getting rid of hepatitis C is no longer a scientific one. It's a public health one.
And this leads us to the critical paradox we're facing right now. We have the perfect weapon to defeat this virus, yet it's still claiming hundreds of thousands of lives every single year. So, why is that?
Well, the answer goes right back to the virus's greatest weapon. It's silence. Because the infection shows no symptoms for decades, most of those 58 million people carrying it just don't know they have it. And since there's no vaccine to prevent new infections, the virus just keeps spreading, completely undetected. What we're left with is this huge gap. Only a tiny fraction of people who are infected have ever been diagnosed, let alone treated.
This is where the battle is now. The solution is all about proactive screening and diagnosis. And general practitioners, or GPs, are really on the front lines here. They're in the perfect position to identify patients who have risk factors, like maybe someone born between 1945 and 1965, or someone with a history of drug use, and make sure they get a simple blood test.
Look, we have the tools to make hepatitis C a rare disease. Science has done its part. What we need now is awareness and action. We have to find the millions of people who are living with this infection and don't know it yet. And that brings this huge global fight down to a very simple, very personal question. Have you been tested?